What's up, YouTube? All right, today is 3 weeks and 2 days since the surgery. So we're looking at, today is Saturday. Anyway, the surgery was on the 13th. That was a Thursday. I wanted to update everybody on the medrol pack that they gave me for the sciatic pain. Like I said, that pain was probably a 9 at night. I couldn't sleep. Taking the medrol pack today, I say my pain level in my sciatic or the leg is, I'd say right now it's a 0. So whatever they gave me knocked that out. I'm hoping that it stays that way. I don't know how long that stuff stays in your system, but from day one taking those pills, by the end of the day the pain had subsided, and apparently that's what it's for. It's like the gold standard in back pain when you get sciatic pain issued from a disc. I don't know if it would help low back pain, but as far as sciatic pain, when you're having trouble walking, sleeping, it's supposed to be, that's what they're going to give you first. And, it's done wonders. I was a little concerned it might slow down the fusion process, but at that point I was ready to try anything, and that was around the 12th day after surgery. The only other updates, I'm still using the muscle bone stimulator twice a day, or actually once a day for 2 hours now. I haven't worn the back brace at all. I never had to use a walker or any of that. But the weirdest thing I'm getting now is in my left lower abdomen. Man, I'm getting this burning pain. I've never had a hernia, but like even right now I can feel it, and it's a nagging pain. It's probably a 2 right now. But when I walk, even, I walk, my wife and I just went to a furniture store and I walked around, took the keys, and I said, look, I'm going to wait in the car. Just walking feels like it's pulling and burning. I can't wait to see the surgeon. I know I'm supposed to meet with him on the May 23rd, so roughly, 18, 19, 20 days from now. I'm counting the numbers, the days down, because I want to find out, man, what is this? What's going on in here? The incision they made was right below my belly button, all the way to the top of my pubic hairline. And, that's incision pain, and it's not that bad. At 3 weeks, it feels pretty good. I'm waiting for him to tell me when I can take a bath or get in the hot tub. I've been taking showers just kind of facing my back towards the shower head. I've got a sprayer. I recommend you get one of those. I got one of the raised toilet seats that raises the seat probably 4 or 5 inches from Walgreens. I think it was like $80, but man, it was worth it. It's got the 2 handles on it. It just kind of attaches. I'm about to get rid of that, but there were times when the sciatic pain was so bad I would go and just kind of hold myself up with the handles just to kind of decompress my spine a little bit. So update, the medrol pack steroid has helped the sciatic pain almost to a 0. And my biggest issue right now is the lower ab pain, and biggest concern is not knowing. The other thing that when they, and I don't know if you could see us on camera, but see that vein there? When they did the IV at the hospital, I remember the nurse saying, man, your skin is thick. Like when she pushed it in, and man, it hurt. And I've never had an issue giving blood, taken blood, hidden an IV, never had an issue with that. And I'm thinking, it kind of, you know, I'm getting ready for surgery as they're placing the IV in, so it's not like, you know, I'm going to say, man, something doesn't feel right. But after surgery, I mean, it's still sore where the needle went in, you know, up my forearm. You can't see, sorry, this camera work sucks. You can't really see where it's maybe right where that mark is, that purple bruising. But it hurt like hell when they put it in. Well, when they took it out, it was really sore at the where the needle went in. But now it's almost like, I don't know if they collapsed the lung. I don't know what you call it, but man, the vein from that spot all the way up to my hand, where you can tell it's super swollen. I mean, here's my left hand, you know, normal. You know, I got a lot of veins, but not big lumpy ones like this, you know. I mean, you can see that. So I don't know what they did. It hurts, but it's not like super painful. So I'm probably gonna wait, unless if this starts hurting more than it does now, then I'll probably, you know, call the nurse line or something and talk to them and see what's going on. But, you know, I didn't document it or anything while I was at the hospital. I just wanted to stop. I want it to be fixed, whatever it is. And, you know, my main concern right now, as long as this sciatic pain stays away, this lower ab pain, and I think part of it is this has been hurting since day one, since the surgery, but because the sciatic pain was so bad that I didn't really focus on this. You know, it's almost like whatever hurts the most. If you have injuries, you always focus on the one that hurts the most. So that's my update, trying to keep these under 8 minutes. But if you have any questions, again, I'm not a doctor, but man, I've seen so many back surgeons. If I can give you any advice, I'm in the Atlanta area, so I went with the surgeon here. My plan was to have this surgery, be home, you know, get cured, healed, and never have to talk about this again. But, you know, who knows? It looks like, you know, truthfully, I may have to have another surgery down the road for the lower L5-S1. And until that gets really bad, like it was 12 days after surgery, I'm not touching it. All right, any questions, let me know. Thanks for watching.